Hi, it's Dr. Janowski. Today we're going to go over the treatment of the tear trough area, one of the most common areas that needs filler, and actually one of the trickiest. It's a very thin area and it requires a lot of skill to get the product in the right place, but we're talking about that area under the eye where we get shadowing. And Laurel just has some mild shadowing, so she doesn't need a lot, but I like to use the product Restylane Refine, which is a new product from Restylane. It's a flexible product that works really well for areas where there's motion. And I also like to use the microcannula technique, which you may have seen before, but this is a really great area for the under eye because it avoids bruising, it hurts less, and it really cuts down on recovery. So I'll show you how I use the microcannula to place the product. So we'll show you the tear trough injection with Restylane. The first thing I like to do is place a little bit of local anesthetic right here at our entry point. There's only one entry point. So if we make that numb, it's very easy for the patient. I use a special buzzer to distract from the pain of the tiny little injection that we're going to do. So just relax, you'll feel the buzzing. And little pinch. Good, that's one. Next thing I do is create one little entry point with a tiny little needle in that numb spot. A little pinch right here. The patient probably doesn't feel much. If anything.
Didn't feel anything?
Nothing.
No.
Okay. Now we have our microcannula. Again, this is not a needle, it's not sharp. And we use that to place the product by putting it through our little entry point. And then a little pressure. The patient will feel some pressure, but it's not sharp like a needle. Here we go. And then we're going to do some injecting. Slowly. Right into the tear trough area here. Good, okay. Good. So we're already starting to see some nice flattening there. Do a little bit more on this side. Again, a little pressure. And a little bit of injection. Good. Okay. So, Laurel doesn't need a lot, so that's probably even enough for one side. And then we'll go to the other side. So we just did the tear trough injection for Laurel here. It took less than 10 minutes to do. You'll see two little blanch points here. That's where the lidocaine and epinephrine was for the numbing. That'll be gone in about an hour. She shouldn't have any bruising. These little dots will disappear. There's basically no recovery from this. And you see a nice immediate effect of filling and brightness under the eye. The nice thing about Refine is it really doesn't swell very much, if at all. So a lot of people are concerned about swelling under the eye after the treatment. We've really cut down on that tremendously with this product. So that's why I really love this product for that area. Refine is also good for any fine lines. It's great for the lip as well. So if you need to be evaluated for that tear trough injection, please come in and we'll let you know if you're a good candidate for it.